Welcome, everyone. We're giving a few moments for people to get into the room. All right. In the interest of time, I'm going to go ahead and get started. Thank you so much for joining us today. I'm Heather Esper with the William Davidson Institute at the University of Michigan, and I'll be moderating today's session. And at WDI, I lead our performance measurement and impact work. Before I get into today's session, I want to give a little bit of housekeeping. So for Q&A, if you could use the Q&A function, the box at the bottom, to enter any questions you have. We'll have time at the end for Q&A. We also love a lively chat, so please introduce yourselves, your organization, where you're joining from, and if you so wish, share your LinkedIn profile so we can connect. Also sharing that the session today is being recorded and will be shared with those that registered. We would like to thank Glocal and GEI, the Global Evaluation Initiative, for the platform we have today. And in case you're not aware, this is a part of a larger conference that's going on, a virtual conference, Glocal. WDI has 2 more sessions this week. We have Co-Creating Innovation, Advancing Incubator and Accelerator Success Through Participatory Research. This session with Leap Africa will explore how participatory data collection approaches can enhance program effectiveness and inclusivity with entrepreneur support organizations. So we're going to talk about rich picturing, causal loops, outcome harvesting, design sprints, focus groups, etc. And we're also going to launch a community of practice focused on participatory methods. So be sure to sign up for that one. I'm going to put in the chat how to do that. And then we also have another session on Thursday, Bridging Business Growth, Community Involvement, and Women's Empowerment. This session's with Promo Hair and Care, and will highlight the relationship between business and social metrics, demonstrating why return on investment is an important metric that can further enhance qualitative data and storytelling. We'll showcase how a broader understanding of value creation through community engagement and technical assistance and measurement strategies can both improve social impact and business benefits. And I'll put that in the chat right now as well. So without further ado, I am excited to talk more about today's session. We're going to be demonstrating how using systems thinking, a certain systems thinking tool called rich context mapping, can help uncover the underlying factors of what is driving the funding gap for healthcare startups in Africa, as well as identify innovations that are addressing the issue. Today, you'll engage in hands-on activities to learn how to construct rich context maps by incorporating perspectives from diverse stakeholders, as well as how to leverage the insights to inform the design and decision-making processes. So before we jump into sharing more about the agenda today, we'd really love to get a sense of who's in the room and what perspectives are joining. So we have 4 poll questions for you, and we're going to get those pulled up in a moment. Perfect, thank you. So if you could go through those, this will help us understand who's in the room today, where you're calling in from, what type of stakeholder you are. Right, I'm seeing an investor, seed level business, pre-revenue. Where are we calling in from today? Australia. We've got some Europe, some Africa, North America. Great. All right, I'll give you like 15 more seconds to finish the poll and we'll move on. We have a funder also here in ESO. Oh, wonderful. There's policymaker in the room too. That's great. Sometimes we don't have policymakers. They're often not a part of some of these conversations. So very excited about that. All right. We'll go ahead and end the poll. And we'll share the results so everyone can see. Got a good, not three. Wonderful. All right. Thank you for sharing and doing the poll. That really helps us as presenters. So now I'm going to jump into sharing what rich context mapping is. For that, I'm going to share a Miro board that we'll be using for a large part of our presentation. We'll zoom in up here. Rich context mapping is a way to frame the system through an iterative process that seeks to understand the structures and processes and functions of the system. It's a technique that is used to capture, visualize, and explore complex systems, narratives, or data with multiple interrelated elements. So if I go out, you'll see at the center, what you do, this is a rich context map, these circles. At the center, what you end up doing is you put long-term trends that are putting pressure on the system and call for change. And then in this donut shape around those long-term trends, what you end up doing is you write out all the ways the system currently responds through culture down here. So these are like norms and values, what people think, as well as practices, routines, and behaviors. That's what people do, as well as economic structures. This is really the market, financing, consumption, production, distribution, typically steered by the free market. And then, of course, here we have institutional structures where this is where rules, regulations, power structures, a lot of things steered by the government end up usually following in this quadrant. And then in this last circle, what you put are emerging niche initiatives. These are things that are innovations or programs that are currently underway that address the issues or system responses. And they're put in that outside circle by like which quadrant they're trying to address. And they could be addressing multiple components of the quadrant. And the real value of doing a rich context map is that it can be used to assess how your organization or business fits in within a system of interconnected issues, system responses, and current innovations. But it could also be helpful to use, like if you do a rich context map and you look at it over time, like you're filling it out once a year or something and seeing how a system is evolving and how tensions change. So what we're going to do for today's session, we're going to first hear from Jean. She's the regional lead of East and West Africa at Helium Health. Helium Health is an African-based health tech company founded in 2016 that provides digital infrastructure to modernize healthcare delivery across Africa. Its flagship product, Helium OS, is an electronic medicals record and hospital management system tailored for emerging markets, complemented by tools like Helium Pay for billing, Helium Doc for telemedicine, and Helium Wallet for payments. And then through its fintech arm, Helium Credit, the company offers collateral-free loans to healthcare facilities, leveraging operational data from its software to assess creditworthiness and facilitate rapid funding. They serve over 1,000 providers and 10,000 health workers, and it supports more than 300,000 patients visits monthly across 7 African countries, aiming to bridge the continent's $66 billion healthcare financing gap. So what Jean will do is fill in a rich context map from Helium Health's perspective as a business as it relates to the healthcare startup financing gap in Africa. And then I'm just going to give you a preview of what we're going to do the whole session so you have a sense of what's coming. After Jean's presentation, you're going to have the opportunity as an audience to use the chat to share additional points that you think should be added to the rich context map she presented. And us as moderators will kind of take those out of the chat and put them in with orange sticky notes. Then Moses, Senior Program Manager at Villgro Africa, will fill in a different rich context map with green sticky notes from Villgro Africa's perspective as an entrepreneur support organization. Villgro Africa is a Nairobi-based incubator and impact investor that supports early-stage health and life sciences startups across the continent. Since its founding in 2015, it's provided seed funding, mentorship, and business development services to over 100 companies, catalyzing more than 40 million to follow-on funding, impacting over 20 million lives. Focused on scalable, market-driven solutions, Villgro Africa aims to improve healthcare access and affordability for underserved populations throughout Africa. And then after Moses' presentation, again, the audience will have the opportunity to identify additional inputs, which will carry over to the Miro board. And then finally, we're going to hear from Rajat, WGI's Senior Director for Innovations and Partnerships. Rajat will summarize takeaways from the rich context mapping and a path forward. So without further ado, I'm going to turn it over to Jean.
Fantastic. Thank you so much, Heather. Thank you for having me here. Really excited to be here. And thanks for the introduction. So I'll just take you through our perspective as Helium Health, being a digital health company, a healthcare innovator in this space, and also a healthcare innovator that's working with facilities as we lend money to them. So we'll start in the center, and I'll try and speak to the different quadrants as we go along. So some of the things that we've seen, with regards to funding, you often have moving targets that come from investors, get to X revenue, get to X number of facilities, get to X number of clients, and then we'll invest. And some of the things that we did see quite early on. So Helium started in 2016, and we got into Y Combinator in 2017, and that was a game changer for us. And so we've seen that having those accelerators, those incubators make a huge difference in terms of building your visibility, the trust element. People will invest in what they trust and what they know. But sometimes it can be difficult if you're a sole founder, a small company, you're investing time in all of these accelerators, 3 months, 6 months, 9 months. And so ensuring that where you're spending your time actually adds value to you. And some of the other pressures that we've seen, particularly in the public sector, so we innovate for both private and public sector, is a long sales cycle it can take in public sector. 1 year, 2 year, 3 years, just to get that signature on the dotted line. And the lack of dedicated funds that comes from the public sector. So while there's a lot of demand to scale in public sector because that's where a lot of impact can be realized, the truth is it can take really long. And so the real value comes when you're then able to have these sort of models that come in, and we'll address that in the outer circle when we come to looking at some of the things that we've employed. And then when it comes to innovating in an already underfunded space, we have persistent underfunding in the healthcare space. And because you can see it in the other donut, I'll speak to it just now. Heather already mentioned this, but the $66 billion deficit in healthcare financing, how are we be able to address that gap? So for us as Helium, our Helium Credit is our financing arm. We lend money to healthcare facilities. And what we found is that 80% of those facilities that are applying for credit, they fail our readiness assessments. They won't even be touched by banks, and they'd prefer coming to us because we're not as stringent as your typical bank would be. But then they don't have the corporate governance in place, they don't have the financial literacy. And so what that calls for is for having tailored financing where you can start to de-risk and ensure there's financial sustainability. So you have to have these targeted capacity building initiatives. So we've been able to unlock and give out over $11 million in loans because of that. And I'll speak to how we're innovating in that space when we come to that outer area. And then obviously, we can't ignore the misalignment that occurs. A lot of times the investments that are happening in this space, we won't always have investors with local knowledge and local context. And so that misalignment and the pressure, in Kenya, we say vituka ground, things on the ground, are not always as they seem. And so that pressure to sort of take models that do not work for our use case, that copy paste, and then now to try and show progress through that. And then when we look at the cost of development, obviously, if we're talking about digital health, the health tech, there's a lot of costs that go into it, whether it's a cost of engineering, the investment for infrastructure, the hosting costs. And then on the flip side, you'll have your client who says, well, can you just give me a freemium model so I can see if it works in my context? I just want to see if it's something that I want to put money in, particularly in the public sector. And then how do you now start to convert from a freemium model and go into a commercial model? And then when we look at the product development cycle. So we have so many complex problems and things that lead to slow adoption and affect adoption. So we work with healthcare facilities and we deploy our solutions to those healthcare facilities. But often you'll have such high staff attrition that can sometimes lead to churn. So how do you show that you have adoption? It can be difficult to show traction, and then you don't always have the data to sort of demonstrate that product market fit. And then again, other challenges that we've seen, this digital infrastructure barrier. How do we talk about digital transformation without the backbone? And we're not a digital infrastructure company. We don't build the tools, the devices. And so it makes you think about other ways in which you can show the adoption, show the traction, so that you can begin to answer those really critical questions. And then when we look at the focus, financial metrics versus tracking of impact, one of the things that we were really fortunate about early on was that we were able to align ourselves with investors that really were focused on impact. And so we'd started tracking and measuring our impact very, very early on. And so that requires patient capital, right? Because there's a validation element, there's trust that's required, and that takes time, particularly in the healthcare sector. So if we move a little bit to the current system and what's happening, when we talk about the healthcare deficit, how we're addressing that through our tailored financing is, when we go out to facilities to be able to lend to them, we're not just thinking about, can we just give you a loan? We're thinking, how can we get you ready for these loans? How can we prepare you to be better equipped so that when we're lending to you, we're building your financial capacity, we're making you more operationally efficient. And what we've seen is that then that leads to increased revenue from our facilities. And when we think about the misalignment that sometimes happens between investors and the healthcare startups, particularly on the continent, where we're trying to adopt models that work in the West, what we've seen particularly around our products is that SaaS is not always applicable. SaaS will not work. And so how can we measure progress? How can we show this traction and think through a lens of collaboration as opposed to competition? And so for us, one of the really key factors is in this collaborative approach that we're going with. And when we think through the regulation, the institutional structures, just going up to that quadrant there. Obviously, when we're thinking about emerging technologies, we have a lot of changing regulations, a lot of guidelines, coming in, whether it's at a national level, whether it's at a local level, a global level. And sometimes the complexities is that your teams don't necessarily have that technical capability. So how can you ensure that you're beginning to address that? And I'll just speak to how we're addressing that as we're in the outer quadrant. It's making sure that you're building with interoperability in mind, adhering to the global standards so that you're not having to keep changing your product. You're not having to now start, reversing. So if you have an innovation and you're thinking about scale, about growth, build with that interoperability in mind. And it sort of speaks to the point at the higher point there about scaling in multiple markets. Multiple markets require different certification processes, different accreditation. It takes a lot of time, it takes a lot of money, the investment that's required to do all of this to scale into the different markets. How do we ensure that we're able to address such challenges? And so for us, what we're advocating for, and I'm glad there's a policymaker in the room, is where you have these policies to ensure that you have coordinated efforts to ensure this cross-border scaling. There's no point of reinventing the wheel. If we've tested the market in Kenya, we've tested the market in Nigeria, yes, there's context that you need to apply, but if we're able to scale seamlessly across, then we'll begin to see these innovations really, really scale up. And when we think through the initial challenge that I talked about with regards to the long sales cycles in public sector and needing to show traction in public sector. One of the things that's really exciting and is really coming about right now is this mountain model approach when we think about the emerging ones. So you want to scale in public sector and you can think through co-creation. So you're not pushing a product on them, it's more demand driven. And so you're co-creating with them. There's that acceptance, and you have to think through innovative models. One of the things that we did at Helium really, really early on to get into public sector was we said, okay, you need software, you need infrastructure. Let us do the hard work. We'll partner with someone to bring in the infrastructure, to bring in the software, so we can deploy in public facilities. And what that meant was we had to think through, okay, how will we get the revenues coming in? So thinking through revenue sharing, thinking through reimbursements, and it didn't always work out. Sometimes it was a bit tricky, it was a bit difficult. We had to sometimes fail and then quickly iterate, so it sometimes meant changing the model. So for example, we had thought, oh, we'd support them, for a month or 2 months. But if you have older healthcare workers, older consultants, they're not quite sure how to type. And so that also brings in the element of digital literacy. And so can you partner, can you collaborate with someone who does that element so that you can add in that piece as well? And then when we think through the current system and some of the economic factors that are at play, for us, our largest client base is in Nigeria. I remember one day, you literally went to bed and the Naira was about 400 Naira to the USD, to 1 USD. And then the next day we woke up and it looked like 600 to 800. And even though you've buffered, you've put in mechanisms in your model, you've tried, you're reporting your revenues in USD. So essentially overnight, your revenues can just be halved. So how do you even start building in mechanisms and factors to buffer for that? So thinking through bringing in more stable revenue, whether it's in USD or other, thinking through how to cushion that as well. So for us, as I just bring it to a close, I'd say that the two main things that we have really focused on to show that traction, to show that growth, to be able to get that investment coming in, is in the element of collaboration, right? And I think sometimes people are really scared of collaborating because, you're for profit, you need to show return investment, you don't want to give away your competitive edge. But it's really, really important to know that you can't solve everyone's problems by yourself. And so ensure that you're collaborating. When you come together, you're able to show value. And that speaks to how do we begin to open up this value that people will pay for. When we think about the bottom quadrant here, people will pay for what they see value in. If it's addressing a problem, and how do you begin to translate your solution into actual value? So collaboration, and then also thinking through these innovative models, the mountain models. And I know that Moses will also speak to this because it speaks to the work they do as Villgro, whether you're able to connect private sector innovations, to the public sector and show this scaling. So I'll stop there for now because I'm sure my time is almost done. Thanks, Heather.
Wonderful. Thank you so much, Jean. And for those of you in the audience, this is the time where we'd love to hear from you. We've reserved some orange sticky notes that if you have points that you would like us to add that we didn't get to cover as it relates to this perspective from a business, we can add those in. I don't see any in the chat yet. So maybe what we'll do is we'll go on to Moses in the interest of time. But as you put things in the chat, you could do those even when Moses is presenting, put them in the chat and we'll be carrying them over. We've got multiple people behind the scenes helping out with this. So let me turn it to Moses. Thank you.
Can everybody hear me?
Yes. Yep. Thank you, Moses.
Excellent. Thank you very much, Heather, and thank you, Jean. You said a lot of things that resonate with the things that I'm going to speak about. So just in terms of background, Villgro Africa is a business incubator and impact investor that supports startups in the health and life sciences. So we do deploy capital in terms of equity and grant, and we also provide technical support together with the capital. I think to start off, I'd just like to, looking at the long-term trends, begin by saying that part of the reason why we exist as an ESO is because of this recognition that it's very difficult to run a business in the health sector, particularly in Africa, because we are trying to shift from a background where healthcare has traditionally been funded by donors for the last 50 years or so. We've had a situation where most healthcare has been provided by government, but funded through donors. What that means is that there has been a distortion of health markets. And so as we move to a business model approach where health startups are coming in to address health system gaps, that's the kind of context they are coming to, a context where in terms of payment, for instance, services have been provided for free. And then moving on, what that means is that for healthcare ventures coming into this space in the last 10 or 15 years or so, these ventures have been coming in to actually develop the market. So in a sense where a market sort of didn't almost exist, you had government, you did have private sector, but dominated mostly by larger businesses. So for health startups, therefore, traditional VC is not enough, and customized products would be more the kind of funding that is needed to de-risk the businesses in this kind of environment, and also to fund some parts of healthcare delivery that you cannot expect businesses to finance themselves. So, speaking to infrastructure gaps, and Jean spoke a bit to that, because there are gaps in terms of the kind of infrastructure that exists. What you find is that the health startups then have to incur a lot of cost, and they end up transferring these costs to customers, which in a sense then is like shooting yourself in the leg, because you transfer the cost to the customer, and that then ends up shrinking the market. So other things we've seen is that as a result of this context where a lot of funding, a lot of businesses are funded through, or rather a lot of healthcare delivery is funded through donor funding, and the need to de-risk those businesses, most of the funding coming into the startup space has been foreign funding, and with very little participation of local investors. The implication of that for the ecosystem has been that it's been really highly subject to global shocks. So as recently happened with the shift in USG priorities, we find ourselves in a situation where a huge source of funding is no longer available on the one hand, and on the other hand, because of this limited participation of local investors, there isn't much in terms of a safety net. So I think I'll move on to the context as far as the economic structure is concerned. And on the economic structure side, what we see is that in terms of the economic context, a lot of payments for health services are out of pocket, and we don't have a lot of risk pools to finance health service consumption. And what that means is that health emergencies or situations, or the need for healthcare, does not always align with the availability for money. And then coupled with that, we have a lot of our people who operate in an informal economy, which exists simultaneously with the formal economy. So you have both the formal and informal economy operating together. And the implication of that is that from a data standpoint, you don't always capture data in terms of the real situation on the ground. So available data doesn't always point to what is really happening, and that complicates the situation for health startups that are trying to build solutions for these markets. Jean spoke a bit to this issue of synergy between the public and private sectors. So as entrepreneurs in that space, we've noted that they will have to encounter government at one point or another, either as a regulator or as a channel to market, or as a market itself. And yet, in terms of incentives, they're not always aligned. So to give an example, some startups would be wanting to provide services that make or innovations that make service delivery cheaper, and would have implications for the patient. But when you look at the health system, not everybody might want services to be cheaper because they might be benefiting from the status quo. I'll move on quickly to institutional structures and speak a bit to the regulatory context. So part of what we see both regulatory gaps where some innovations being brought to our health markets arrive and find that there lacks a licensing regime for them. And so we have seen situations where, to give an example, one of the businesses that we support that provides home-based healthcare services was not able to find a licensing regime, and they ended up registering as an Airbnb. So what you see is that innovation precedes regulation, which is not necessarily a bad thing, but in some cases it inhibits the ability of innovators to develop and deliver services. The other thing we see is barriers where existing regulations make it very difficult in terms of cost, but also in terms of fragmentation. Businesses you find might need several licenses, several different types of licenses from several institutions of government, which makes it very unclear for the businesses and consumes time and resources. And when you look at the cultural context, what we find is that as health startups are piloting, delivering innovations, they are coming to a context where patients have a preference for human contact. And this then creates a situation where if you're delivering digital health solutions, for instance, adoption is slow because the market is not used to these kinds of approach. And there's this thinking that to get treatment, you have to be seen by a doctor, you have to be touched by a doctor. And in line with that, we also have a lot of self-medication with patients, where what we see is that patients will go to the health facility or present to a doctor when they have exhausted all other options. They've been to a pharmacy, bought medication, they might even have tried witch doctors. And the implication here is that they then arrive when situations have complicated. But then, from the startup perspective, it means that there's competition from those other approaches that patients would want to try out. Finally, on the culture side, there's also this thinking and idea that health should be a public good. And so government should pay for it. And when startups are trying to pilot approaches that require people to, for instance, prepay and get insurance, you find that there's resistance as a result of that cultural thinking. And even where healthcare is solutions such as insurance are being adopted, what you find is that there's a lot of cases of misuse of insurance services. This thinking that on the one hand, insurance is expensive, but if I've paid for it, then I must claim. And that's then obviously bad for businesses. So very quickly to finalize, what we see in terms of practices is that for innovators, because of this context where funding isn't very available, we see a lot of startup founders who are moonlighting, running a startup on the one hand, and maybe 2 or 3 side businesses, and even sometimes employed. We also see situations where startups end up partnering with each other to address some of those infrastructure gaps that I mentioned. But then from the investor perspective, all of this translates to risk. So a startup will be seen as not to be focused when the innovator is busy doing side businesses. And then finally, what we see is we see a lot of the same startups applying for different incubator programs and also remaining within that space for a very long time. So you would expect that startups would want to sort of be in an incubator for a year or two in the early stages, but what we end up seeing is startups wanting to move from one incubator to another. So for a period of 4 years, they will sort of be stuck in that loop where they go into one incubator, then another. And what ends up happening is it consumes a lot of time for them and takes away time sometimes from actually building the business. So in terms of what we are seeing as interesting initiatives to address this, we are seeing a lot in terms of focus in midwifing startup and government relationships to open up markets. We ourselves as Villgro Africa are part of projects that are working towards that end to expand markets for startups by allowing them to work more closely with government. We are also seeing more collaboration across accelerators and other ecosystem partners. So for instance, there's something called the Africa Health Investment and Scaling Platform, which in a sense is trying to address this problem where startups are stuck in that accelerator loop and sort of move them faster to scale by quickly identifying the key needs and then taking an ecosystem collaborative approach to deliver them, even if it means for accelerators to work together. I think I'll stop there in the interest of time. Thank you.
Wonderful. Thank you so much, Moses. We've gotten to hear from 2 different perspectives, from a company and then an entrepreneur support organization like Villgro Africa. And we would welcome in the chat any other points that you think from your perspective, whether you're a policymaker, investor, funder, that maybe we should think about adding to the rich context map. And feel free to put those in, but in the interest of time, I'll also just pass it off to Rajat, who's going to show us how to utilize some of these takeaways. So let me go back to the slides. So give me one moment.
Thanks, Heather. And thank you, everyone, for joining us. Really great to have you today with us. Now, we have heard some wonderful insights from Jean from an enterprise perspective of what are the challenges they feel from a funding standpoint, and from Moses as well from an incubator and an intermediary standpoint in terms of how they are looking at this environment and how they are trying to address some of these things. I think as we look to reflect upon these opportunities and also the reflections at different levels, it will be good to look at our insights at a micro level, focusing only at the enterprise, at the meso level, which looks at the intermediary and at the organizational and the country level, but at the same time, look at it at the wider ecosystem level and think through what are some of the commonalities that we see and what are the potential opportunities that it creates for us going forward. So let's start at the micro level. I think one of the critical aspects, and both Jean and Moses also reflected to it, is there is a funding gap more acutely at the early stages. The enterprises, innovators, and investors are more interested in funding scaled up models, which are already growth ready and have demonstrated better commercial viability. Early stage founders often lack of collateral, which is required to access some of these capitals and different financing instruments. Healthcare enterprises, we spoke about, there's a high cost of market entry compared to some of the other areas or domains. You require certification, there are regulatory compliances. If you're looking at products, you need to align with the essential medical list with the governments, and there are WHO pre-qualification requirements for diagnostics and many other things that are critical. So the market entry is not that easy to do. Also, we have seen specifically in healthcare, investors discount local context and knowledge, which is a big challenge. And we feel, finally, in terms of affordability, we both Moses and Jean spoke about value creation, but there is a big challenge around patient affordability in sub-Saharan Africa, and that often limits commercial viability of the engagement. But all these gaps also create some opportunities as we move forward. One, there is a role for intermediaries in providing the capacity building support, but also local investors to come in and do some investing at the initial stages. The capital that we are providing to many of these startups has a huge potential or need to be blended, also be more patient. When we say patient, looking at longer term financing options, looking at revenue based financing, being more creative with the different financing products that we can offer would go a long way. And I think specifically in African context in healthcare, it is important for us to move beyond the product market fit and look at the product, market, and policy shift. I think that alignment to the global ecosystem, the environment, Jean spoke about the currency fluctuation. There are other challenges around regulatory compliances and environments as well. We need to align with those policies. If we are looking to scale up to another geography, what about interoperability? What about privacy? What about some of the other challenges that often are regulatory and not operational in nature? So we need to look at the product market and policy fit. Maybe next slide, please. At the meso level, looking at the ESOs, intermediaries and networks, one of the biggest challenge that we have seen that intermediaries themselves are donor dependent. We are over reliant as incubators and accelerators on donors, and we do not have the right financing model figured out for ourselves as well. This often leads to duplications. This often lead to inefficient services that are being offered to enterprises. We do more harm than good. So how can we we need to work around those things. The second, we spoke about how at the enterprise level, this is a challenge that stems at the institutional level as well, that the financing instruments, they're not aligned at the right stage and the right time of the innovator. More often you have either debt, you have equity, but you are not helping the entrepreneur understand what's right for them. And that gap needs to be addressed. Incubators primarily are more generic and offer standard cookie cutter approaches. Are more focused incubators exist in fintech space, but not many in healthcare. Villgro is unique from that perspective. But I think we need more of that. We need to give more sector specific support, and we need to dig deeper into specific areas. Just like enterprises need to specialize, ESOs need to specialize as well. And finally, the ESOs need to shift away, and there's an opportunity for them to look at transaction support of the way they are currently delivering it. I think there is a big gap. We need to focus more on the long-term ecosystem building, move away from short-term support that we are offering. And Jean spoke about the work that she did with Y Combinator. Well, Moses spoke about how they are actually supporting enterprises. So there are opportunities to go deeper the way we do. And finally, we need more local fund managers. I think we need investors to understand the context. The more context we understand, the more we are embedded in the local ecosystem, we'll be able to de-risk the investments that are made primarily by global investors. Next slide, please. And I'll move quickly at the macro level, looking at the policy environment. Both of my colleagues spoke about the lack of funding. In 2024, only 3.2% of the investment actually went to healthcare, the VC investment. You know? So there are big challenges. We are investing, Africa is getting investments, but not in healthcare. And donors and DFIs, they are primarily looking at large scale health system reforms, not at so startup innovations. And the current funding environment is disrupted with what happened with USA. So what are the opportunities that we see? There is a need to focus on policy reforms, licensing, interoperability, partnerships that will streamline the health innovation pathways. We spoke about the mountain model. There are a lot of other ways we can engage with the system, but we need to do more of that. There needs to be a harmonization at the policy level. And finally, we need to look at more co-investment models. Moses spoke about the Africa Health Investment Platform. I think we need to do more of that. There is money out there. There are willing partners out there. We need to ensure how we bring them all together and we are all speaking a common language. Next slide, please. And there are these common patterns that we see across all these levels. Even in what Moses and Jean spoke, these are things which are reflective. Risk misalignment. There is a big perception around what is the high risk associated with investing in healthcare in Africa. The return profiles are low. So we need to address that gap. Oftentimes, these are misconceptions. If we dig deeper into the financing models and how these businesses operate, we will be able to address this. There is lack of contextual understanding, both by investors and policymakers, and that actually make them more apprehensive of engaging with healthcare models and businesses. And healthcare, as my colleague said, is complex. You have long sales cycles, complex stakeholder landscape, and there's always this tussle between the value and volume, which actually makes it difficult for external investors to align. And we need to speak some common languages around this. Last slide, please, Heather. Right. So finally, what do we need to do? I think there are three strategic drivers we need to focus on. One, strengthen the cross-level alignment. Build share measurement frameworks that will meet both the entrepreneur realities and the global investors' expectations. We also need to invest more in bridging infrastructures, create regulatory sandboxes, policy labs, align the ecosystem, bring the stakeholders together. And most importantly, shift from an extractive to an empowered ecosystem. We need to place the entrepreneur at the center. They need to be part of the global decision making, part of the investment process that you are creating. Not just focus on return on investment, but also focus on patient and local systems change that the entrepreneur are going to create. So I think those are some of my reflections. Heather, maybe I'll put it back to you to take us forward.
Great. Thank you so much. So now we want to open it up to Q&A. We have a question in the chat from Brandon. And so here, I think that slide that you just ended on, Raja, is a nice tee up because he's saying it seems conversations from stakeholders can lessen the risk by lowering costs. This can be logistics to the creation of micro markets that can be replicated. Do you see other funds willing to come in, governmental or industry or NGOs? And I'm curious, maybe from each of our panelists' perspectives, how they would answer that question, because it may differ a little bit. So let's, Raja, do you want to start? You're off mute already.
Yeah, of course. Thanks, Heather, and thanks, Brendan, for the question. I think I see that there are more and more collaborative, philanthropic collaboratives that are coming up in this space. Moses spoke about the Africa Health Investment Platform, which is being formulated right now in collaboration with Health Financing Coalition. And WDI is engaged in that as well. But there are existing funds like the Transform Health Fund. There is a new MNH fund called the Beginning Fund that is coming up, where different donors and partners are coming together to actually align at systems level, to have common investment philosophies. And if you look at most of these funds, the value is that they have people who are based in countries and understand the local context. So I think that is the future of where we are headed, but we need to do a better job in terms of the kind of funding we are providing. We need to move away from the cookie cutter debt and equity investments and be more contextualized in that.
Great, thank you. Moses, Jean, anything from your side to respond to Brandon?
Thanks for the question, Brandon. Absolutely. I think, especially with the recent cuts, it really showed the need to diversify funding. And so it's been a wake-up call, a rude awakening perhaps for governments to just see how they need to take up the responsibility, particularly like for us in digital health. A lot of our systems were affected, because historically those have always been paid for by, US funding or other such partners. And so I think the responsibility for governments and other players, is coming together, because sometimes it's not that there isn't money, it's that we've found other priorities and we've invested differently. And so being able to come with funds to put into local innovation, just like Rajat has said, and Moses and I alluded to, having an understanding of the sector, it really makes a difference towards the funding. So absolutely agree that we do need to diversify the funding pool.
Maybe I can also chime in. There has been ecosystem efforts to mobilize local capital. Unfortunately, some of them were donor funded and have been impacted by this situation that we are now in. But I think more and more the need for local capital is becoming apparent. We talk with government as part of the work we are doing, and they are also realizing that they need to think differently. So I think the situation we find ourselves in now is going to provide impetus for us to find local solutions. And I think in the next few years, we will see a different situation. One other source that hasn't been explored, particularly in Africa, that I have seen has been explored in India is like the corporate sector. And there's lots of opportunity to bring in CSR funding, but also a lot of advocacy needs to be done to get the actors in those sectors to see the need, which then brings us back to the point that Jean made earlier of value. Going forward, I think value conversations will be at the forefront. If you're not offering value, then it will be very difficult to create partnerships. But this is, in my view, a necessary correction of particularly health markets. Thank you.
Great, thank you. And Brandon actually has a follow-up question before we move to 2 questions about the method of rich context mapping in more detail. But for any of the panelists, feel free to come off mute. But he's asking, this may be more of a macro question. Is the IMF a hindrance? Do we see China coming? Anyone have thoughts on that?
I actually have a couple of thoughts, if I may. I think there is a chance of that, considering there is a gap right now in the investment, and we have seen a lot of Chinese investment in the infrastructure sector in Africa over the years. Be it Ethiopia, if you look at the social economic zones, you will see a lot of investments which is coming from China. And I think there is, with the current funding scenario, there might be an opportunity for them to actually move into that space that way. Having said that, I have not seen any immediate indications around that, but I think if this continues for a period of time, which is my hunch will do, I think you will see some investment coming in that area. And I'm more specifically talking from a healthcare standpoint, not from other sectors. I think if we look at energy and if we look at some of the other infrastructure, there might already be investments happening.
Thank you, Rajat. Jean, Moses, anything further, or I'll hop to the next questions? Right. Oh, go ahead, Jean. I see you came off mute.
I was just going to say nothing further from me. I mean, maybe a slight point, just like Rajat has said, definitely, at least here in Kenya, for other sectors, there is a lot of investment from China. I think for the healthcare space, we've not seen it as much. Doesn't mean to say it won't happen, but definitely the other sectors that has already begun to evolve.
Great. Thank you. And then we had two questions about the process of using rich context mapping. So I'm going to group them together. One is on how do we organize around stakeholders in a rich context map? And then also what happens when you do have gaps in a rich context map? How do you address for this? How do you work to close the gaps? And I'll go ahead and take that from the evaluator perspective in the room on this panel, although we're all evaluators in different ways. I know Moses wears that hat as well. But for a rich context map, what we did in this presentation today was a little unique. Like first we had Helium Health share the enterprise perspective, and then we went to hear from an ESO perspective through Villgro Africa. Ideally, what you would do is have a workshop setting where you have the different stakeholders you would like to populate a rich context map together in a room, whether you're in person and using like real sticky notes or virtually using a Miro board like we did today. And really a lot of the value in doing a rich context map is when you start having conversations where there's differing perspectives between different stakeholders or different people bringing different experiences to the table. And so it really depends also. So that's usually how you do it. But you can do it in a lot of different ways. It depends largely on why you're creating a rich context map. You may be doing it at the beginning. I mentioned sometimes organizations have a rich context map of the ecosystem they're operating within, and they kind of check in with it every quarter, maybe annually, to kind of see how is the broader context in which they are operating as a company or organization shifting, and tracking and seeing how that changes over time so that they can adjust their strategies. Also look at competition in that outer circle when you're thinking about what emerging innovations and initiatives are coming up, or collaboration. I mean, we can't all do these individually as single organizations. I think if you're doing it as an organization, you start to see gaps, and you really should understand what your biases are. Because if you're just doing it with your own team, you all will probably not have all the perspectives within the ecosystem present. So there's ways to maybe you fill out the rich context map from your organization's perspective, and then you share it in an informational interview with a stakeholder whose voice is missing. And you say, okay, this is what we're seeing. What would you change? Or let's move this, and do a kind of a working session with those different stakeholders or where you see gaps. And so with that, I think we'll close the session because that hopefully answered those two questions. I'm going to put in the chat to stay in contact with us, or feel free to reach out with questions. But huge thanks to Jean, Moses, and Rajat for today. Learned a lot, and we're excited to continue the conversation. And yeah, check back with us in some time, and we'll see how this rich context map has evolved.
Yeah. Thanks, everyone. Thank you for joining us.
Mm-hmm.